Hi again, this is Dr. Ken McCurry from Whitney, Plaza Dental in Sheridan, Wyoming. Welcome to Season 1, Episode 3 of Need to Know, NTK. Thank you for joining me. After more than 37 years of practicing dentistry, I've heard just about every dental myth there is, and many of them are repeated so often that people begin to believe them as fact. Sadly, some of these myths cause people to give up on themselves and their teeth altogether. Two of the most common things I hear are, I just have soft teeth, and my parents lost all their teeth, so I probably will too. These beliefs sound harmless, but they quietly steal hope. If someone believes tooth loss is inevitable, why brush? Why floss? Why even come in at all? I see this every day and it breaks my heart, simply because it's not true. Very few people are born with defective enamel. Yes, congenital defects do exist, but they affect a very small percentage of the population. And while those rare conditions do exist, they are not what's causing most people to lose their teeth. In fact, in over 37 years, I've rarely seen a true case in general practice because those patients are usually treated in specialty or university settings. Most people's cavities happen because of an unhealthy oral environment. The environment is shaped by things like harmful bacteria, frequent sugar and acid exposure, especially sodas, dry mouth, often caused by medications or medical conditions, poor oral hygiene, poor diet, infrequent professional dental care. Tooth enamel doesn't just suddenly fail. It's damaged gradually over time when bacteria is allowed to thrive. And when that environment is changed, disease slows down or even stops. Your teeth are not betraying you, they are responding to the environment. My parents lost their teeth, so I will too. This myth is especially powerful and especially damaging. Yes, genetics matter. To a point. They influence enamel strength, jaw shape, immune response, and susceptibility to disease. But here's the truth. Genetics writes the script. Lifestyle determines how it ends. This is what really determines your long-term oral health. Diet, smoking, oral hygiene, stress, sleep, and regular professional care. Families often share habits, not just DNA, and habits can be changed. And those aren't the only myths I hear. There are others that sound small, but do real damage. Things like, if it doesn't hurt, nothing's wrong. I brush, so I'm just fine. My gums bleed because I brush too hard. I'll just fix it later. Dental problems are just a part of getting older. It's not aging. It is disease. I'll just get implants if things go bad. That's not always possible. Insurance will cover what I need. Yeah, not bloody likely. I've already lost a few, that's just how it goes. And maybe the most dangerous one, I'm too far gone, so why bother? Because it's just not true. You're not too far gone, and what you do next matters more than what's already happened. If you believe these myths, you're not lazy or careless, you're just misinformed. Believing the wrong story can cost you your health, your smile, and your happiness. In the next episode, I'll explain why even people who've been told they were hopeless often aren't, and why your past does not have to be your future. If you'd like to learn more, visit whitneyplazadental.org. Thanks for watching.